Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Inshallah, today we already discussed about one scholar that is Abu Al-Qasim Al-Zahrawi Abdul Qasis, pioneer of modern surgery. Uh, in our group, we have four members. That is first Muhammad Zuhairi bin Ratijan, and secondly Muhammad Safwan bin Norman, thirdly Nur Muhammad Shahir bin Murad, and lastly is me, Muhammad Iqbal bin Muhammad Sakwan. And now we want to present uh slide one. We have a through chapter. One is introduction, a second, and then background, and third contribution, and four is the conclusion. We go first to the next slide. All European surgeons after the 16th century gained knowledge and guide the debate on all Zahrawi's books, early European anatomy. Next, we go to the introduction. Abu Qasim Khalaf bin Al-Abbas Al-Zahrawi was a leading Arab surgeon. Westerners call it Abul Qasis. He was born in 936 Masihi and died in 1013 Masihi in Kota Al-Zahra. Initially, he was known as a physician until finally he introduced theory and solution instrument in the science of medicine. Then others recognized him as a surgeon. Next.
So nextly is about background. The real name of Al-Zahrawi is Abu Al-Qasim Khalaf bin Abbas Al-Zahrawi. To the west, he is known as Abul Qasis, born around 936 to 940 in Banda Diraja Zahra, near Cordoba, Andalusia, Spain. He was educated in Cordoba and has practiced his profession in Al-Zahra city as a medical practitioner, surgeon and pharmacist. He was descended from the Ansar Arabs, who had long settled in Spain. Al-Zahrawi's prowess as a modern and leading physician has been well known in Spain, North Africa, the Eastern Islamic Kingdom, and in Western Europe. His prominence caused the then King of Spain, King Al-Ahkam, to appoint him as his personal physician. His whole life was spent in his residential area and he did not travel much. However, he has extensive experience in treating accident victims and those injured during the war. He died in 113 Masihi. Nextly,
1000.
1030 Masihi. Sorry. So the contribution. Throughout life, through his life, 30 manuscripts of the medical encyclopedia Al-Tasrif have been produced covering the fields of surgery, medicine, orthopedics, ophthalmology, pharmacology, and nutrition. All of these encyclopedic works have been translated into Latin by Gerard of Cremona. Apart from the work of Ibn Sina, Al-Vicina, Qanun fi al-Taib, the Qanun of Ibn Sina, this work of Al-Zahrawi has been a major reference in the European medical university from the 12th to the 17th century. Based on the translation, he was famous in Italy in the 13th century. In the middle of the 13th century, many medical practitioners from Italy migrated to France and brought with them Al-Zahrawi medical knowledge. This migration was considered the basis of the beginning of rational surgery in France. Al-Zahrawi work became famous in Europe in the middle of the 12th century until his name became famous in medicine until it is said to be comparable to Celsus and Paul Eginet. Among the world-famous medical figures who use the Book of Al-Tasrif as a reference are Surgeon Roger of Palma, Surgeon Bruno in Calabria, La France, Nicolas de Florence, Valicius. So nextly,
Okay, continue the contribution. Overall, Al-Zahrawi's contribution to the development of society during and after his time is as follows. First, provide information about medical knowledge that can be used and become a community reference. Second, provide space for good healthcare service. Third, to produce quality surgeon candidates. And fourth, independent translation activities. Fifth, develop the field of medicine in Europe, especially related to surgery. After that, discovery of Al-Zahrawi method and treatment in the field of surgery and introducing 150 surgical instruments including tools for obstetricians and dentists. The three famous tools created by Al-Zahrawi are the first, external ear examination device. Second, external examination of the urethra. And third, a device used to remove impurities from the throat. Then, Al-Zahrawi is also an expert in treating disease using harassment technique. This technique has been applied to over 50 surgeries he performed. He was also able to describe various important forms of surgery in the field of dentistry. He even developed technique to prepare denture. He was the first to detail breast cancer surgery, gallstone, and thyroid tumor removal. Next.
So we continue the contribution Al-Zahrawi. Al-Zahrawi has provided information on medical science that can not only be used practically but can also be used as a reference by the community, especially in Andalus. He worked at Tasrif. His work, Al-Tasrif, is a proof of this statement. This work contains 30 papers containing various information of medical knowledge. Among the information contained in it are about the classification of disease, symptoms, and treatment recon- recommendations. Drug as a useful antidote in all cases of poisoning, laxative, and that is good and safe to use. The, the characteristic of laxative pills produced from drugs and prescribed in various disease, food preservation use, method of preparation, and storage of preserved foods, negative and non-negative orders. Negative and pilastering pills, pa- ph- pharmacology, toothpaste, oral and throat medicine. Medicine, medicine used for chest disease, especially cold diet for patient and also for healthy people arranged according to disease drug characteristic, potency and quality, as well as surgical manuals involving cautery, incision, puncture, and the next slide. So, next contribution is the information of medical knowledge found in Al-Tasrif can be used and referenced by the Muslim community at the time. This is because the information is available in Arabic, which is the language used in daily life by all walks of life. It is the knowledge of the common people, and it is also the knowledge used by scientists in their writing. In fact, this is the only language used by the entire Muslim community living in the Islamic world based in Baghdad or in the Western Islamic world based in Cordoba. So, the final slide is the slide conclusion. So, Abu Al-Qasim Al-Zahrawi, who lived between 900 and 36 and 1013 Masihi, as another great Islamic scientist who laid many foundations in medicine. Uh, Surprising, Al-Zahrawi expertise is not only limited to one field, namely surgery, which is his specialty, but also in several other fields. Islam is not at all against civili- civilization, even though people who are not happy with Islam always think that a country, a group of people, or individuals who hold fast to Islam, that then it is progress will be constrained. But the history of Islam records some things different from that. They say evidenced by the presence of an Abu Qasim al-Zahrawi, a scholar of surgery. Europeans can be proud of the advancements of medical knowledge they have today, but Muslim are the trigger. Enough know of what an expert in European anatomy Haley says as proof. Haley said all European surgeons after the 16th country gained knowledge.
So go to the resources, and that is the five resources we got from for this slide or presentation and information. That's all us. Thank you. Assalamualaikum warahmatullahi wabarakatuh.